So please introduce yourself briefly, name, country, and your role related to lymphedema. Patient, therapist, doctor, advocate.
I am a research consultant and a mentor and a lymphedema and massage therapist in India. And I come from a city called Pune, and I work at a major a specialty hospital called KEM Hospital and Research Center. And I'm also a mentor and faculty for Sanjeevani Life Beyond Cancer, which is a totally patient-centered NGO, and we have hybrid programs. Of these hybrid programs, rehabilitation is a very important program. Besides yoga and other, indigenous and complementary therapies, lymphedema is also a very important part of our rehab services. Now, this is all done free of cost. There is no insurance in India for lymphedema. There is no specialized clinic for lymphedema in most of the hospitals, except the government-run comprehensive cancer care centers. Many people send the patients to a physiotherapist, or they say, go and buy a bandage, go and buy a sleeve, buy a compression sleeve. Now the patient's awareness is zero. First thing, they think it is a cancer that has come back in the arm. So we have to, demystify lymphedema to these people. And more importantly, the very few lymphedema therapists need an income. Therefore, their charges are high. And most importantly, a patient expects a cure. While lymphedema does not talk about a cure, it talks about management. And when a patient goes to a therapist, very few of them, they charge you for a month or so, which is a very big expense.
Yes.
It's such a big expense. Unfortunately, what happens is that after 1 month of getting the decongestive massage, manual massage, after getting the rehab exercises, this, what happens is they bring it to a certain maintenance stage by bandaging it. And the bandaging is taught to them. But when the patient goes back home, there is no adherence. The compliance is only at the hospital level.
Yeah, same in Bulgaria. In Bulgaria, the National Health Insurance Fund decided to reimburse only 30 euros per year and only for breast cancer-related lymphedema. In your opinion, is this amount sufficient to cover compression garments, and what does such an approach mean to other lymphedema patients?
We have nothing like that in our country, and people will buy a scarf or a stole, but not a compression garment, because the cost of a compression garment is nearly 30 euros in my country. And 30 euros is half the income, monthly income of a person over there. So they cannot afford it. Now the shopkeepers take you for a ride. The patient goes with a full-blown lymphedema and goes and buys a sleeve. But what happens? They don't let him come back to the maintenance stage. So nobody is there to educate them. Don't buy a sleeve until you have gone through some therapy and your arm has come to a particular size, and after which there is no change. At that time, buy your sleeve.
Okay.
And secondly, if one part of the arm is very big and the other part is very small, don't buy a sleeve at all. Stick to bandaging.
Thank you. Thank you so much.